The mission at Everside is personal to me because I grew up modestly in rural Ohio. My grandfather was a bricklayer and active part of the local bricklayer union, and it became apparent to me that many of these individuals didn't have great access to health care.
I grew up with a dad who was a tough guy. He didn't go to the doctor. He didn't think it was right to take the time off of work. He didn't want to pay those expensive doctor bills. And unfortunately, that cost him years off of his life. By the time he realized just how sick he was and went through an emergent care situation, he only had a few months left to live.
I have 3 beautiful daughters, and one of them, when she was 5 years old, was diagnosed with a genetic disorder. And what I learned very quickly is about how to be a care coordinator, how to make sure that physicians were talking to each other, how to make sure that everybody had the information that they needed so that she had the full and comprehensive care that she required. I have to say it's when I first really understood what it meant to say that healthcare wasn't working.
My son was diagnosed with a heart condition at age 3, and what we thought was initially just a heart murmur and something that was very minor quickly turned into a much broader diagnosis. And after several months of exploratory visits, it was decided that he needed open heart surgery. So that was incredibly traumatic for me and my family. But we were able to get him really the best quality care because of some of the connections that we had. But along the way, we encountered many individuals who didn't have that access to care.
When I look at the work that Everside's doing, and I think about the patients that we're serving, I see my dad.
Healthcare shouldn't be for those who are connected and privileged. Healthcare needs to be accessible for everybody. So when the concept of Everside Health and what Everside Health could do was introduced to me, that's really when I jumped at the chance to make sure that I could help impact the way that Americans receive better healthcare.